So today, just want to go over the Crani part. The supply cart is the most recent addition to the emergency cart. So ideally, when you get the call for an emergency Crani, grab this, but also grab this because it'll save you from running back and forth outside. I've got it organized so that you have prep stuff on top. So you have all your preps, pins, soap, shampoo, hair ties, combs, brush, mannitol filters, because they're hit and miss if they're loaded or not. Next drawer down, you'll have your different burrs, perforator, if they ask for it, hooks, if they're planning on doing a large flat back. Your craniatome is in here as well, and then when I set up the emergency cart, I try to make sure to put one in the scrub bin. But if it's not, if it's just a quick repeat after another one has been done, then you at least know where to find it. Suture drawer has obviously suture in it. Your most common will be right up front. Dr. Teeks has some stuff in here as well, so her Ethibond and her Prolines are in here. I've got a large needle board also that's stocked in the core. I try to leave one here, and once we get our packs, it'll be in there as well. So you'll have a good assortment of suture, so you shouldn't have to go running out for that. Next would be hemostatics and patties. So you have an array of different size patties, starting from small to big. Some Flow Seal. There's secret stash for Crani only of Surgicel. It's not here, but it's here. Don't go stealing it for general cases, but please, if you need to use it during the Crani, go for it. So, secret stash, don't tell nobody. No, we're not advertising it. If your Crani is getting kind of a little extra bloody and sticky and they're fighting through getting down to the root of the bleed, feel free to offer this bipolar. It's disposable, it's got nice sharp tips, they're always going to approximate, they're easy to clean. So they kind of forget this exists, but feel free to offer it if you're finding that they're struggling, or if they ask for it up front. They know this exists as well.
What do they call it? Yellow bipolars?
Yellow bipolars.
Okay, pretty sure.
Keep it nice and simple.
Yeah, use logic like that.
Exactly. Separate film, occasionally they'll want to add a layer in if they need to go, if they're planning on going back later so that they have an easy way to remove the scalp clamp from the dura, so they don't get too adhesed. Faux foam, since we don't have gel foam anymore. And then back in the back is a bipolar, irrigating bipolar cord. It's rarely used, but in case people don't know what it is or where to find it, then I just have it in here ready to go. Next is our dressing drawer. It's got the bandage so that you can make a little party hat. Please leave the scissors in here. Use them and put them back. Don't steal them. I don't want them to walk away, because then that would be the time where, Yeah. Anyway. Loads of staplers. There's more in each room in the 2B core, in the supply cabinet. We've got Curlex and drain sponges and like the typical stuff you'll need for dressings. Lastly, the bottom drawer is your drains and ICP management. So you're going to have your catheter for your EVDs to put along with your Accurate and ventriculostomy set, and then the transducer. They sometimes forget to put it on, but ideally it should be put on sterilely. They can put it on upstairs, but if we can put it on down here, then it'd be best. And then just regular GP drain stuff in the back. Up top, I've got gloves for each surgeon by name and sizes, so we know what to restock it with. So everybody should have theirs. Like I said, the Accudrain here, ventriculostomy kit, and then this is the Camino. So if they need to if they decide they want to monitor ICP without draining it, then they can put in the fiber optic Camino. On the side, you'll find a couple N95s. Most of the time, if you're doing an emergency cart, you're not going to know what we got going on, so keeping everybody safe. And then if we do wind up needing to send a flat, then we want to send a culture with it. So grab the box outside, but then if you don't see a culture swab with it or next to it, and then there's one here as a backup. As far as the cart itself goes, when I'm able to get to it before it gets locked up, then I will separate it out into open shelf, hold shelf, and then nurse and scrub stuff. So I try to keep it as simplified as possible, so you can just grab and go. The items that are on the hold shelf are going to be your fixation set. Sometimes you're not going to be able to close. Dr. Teeks sews her closures, her flaps on, so it just depends on who you're working with and whether or not you're planning on closing, putting the flap back on or not. And then Dr. Teeks' Crani set is in here as well. That includes a scalp fixing plier, the ring clips, as well as she uses a special suction regulator that stays on the field. And so those are in there. If you're working with another surgeon besides her, you're welcome to open it so that they can use the clip plier. And then the Layla bars here are going to be if they're making a larger flap and you need to kind of pull back the skin and then use the hooks. Then you have that here ready for you. So otherwise, everything else up here you're going to want to open. It's got your basic, your neuropsych, Crani set, your bipolars, your drill. So that is that in a nutshell. As far as restocking this, right now it's on us. So case is done, ideally we come back, restock what you used, and then we make sure we call for a new cart. So the desk is usually pretty good about making sure they call for one when we book it. Ideally, sometime in the future, my next goal is to have distribution help us restock this. So for now though, I want to get us in the habit of making sure we restock what we used. And that's that.
Jackie, where's that part of the store?
Right next to this one. Oh, yep. So right outside, around the corner from 208, you're going to find this one, and you'll find this one usually sideways next to it. And I try to keep the little picture on the outside. There is a list of all the things that are in it by drawer. So if you need to kind of review back to what we used and what's missing, if you have a blank hole, that'll tell you. They all should be also labeled too. So. Yes.
In case you're not able to get to that cart and we're called back in the middle of the night, do you have a list somewhere of what is open, what is not open besides the reference card? Something that's a quick.
Something faster than the cart?
Yeah, because.
Just open it all. if you're not
That's the problem.
questioning.
Probably would, but
Which is fine, because it's only 3 more sets, and sometimes, a lot of times they're going to wind up opening this anyway, so then you're only 2 sets over, not that big a deal. And they're going to restock everything anyway, so
yeah.
whatever makes you happy.
When you said that if you send a Crani flap to pathology or lab, wherever you send it, did you say there's a special kit for it, or are you just talking about the swabs? You just need
So
swabs?
there's a special kit for sending off a bone flap. We also want to make sure that we swab it before we send it. And then we always, when we get it back to reimplant the patient, we'll swab it again before it gets reimplanted.
It's on, like once you get the instruction sheet from the top of the pack,
It's part of the
it says
directions.
like, did you swab for closure? And like, it's
Because I
pretty,
have never done that. I haven't even
Yeah.
seen where the kit is.
So it's right outside, we're in 207, so it's
Okay.
right outside the wire rack on the top
it's
shelf.
right, I'm pointing it
Okay.
behind that wall.
What's the protocol on that? Where do we send it?
It winds up,
Freeze, right?
yeah, it winds up going to San Diego, so it takes a nice hot vacation.
There you go.
But we load it up with ice and then it gets shipped off to San
So you
Diego.
put it in ice.
Yeah, so there's the directions that come in the
Step by
box
step, yeah.
are pretty specific as to what the process you follow is.
Pictures.
So we just use the eyes like on like active eyes
Yep.
and then put it in that case and then he'll fix it up from the room.
We'll take it out to the desk at the end of the
Front
case.
Desk.
Yeah, and then the desk is called for a courier.
Okay.
So, yeah, if you're in a case where you know you're gonna be sending off the bone flap, then call the front desk, let them know that's the plan. They'll arrange for the courier to get here. The box is good to stay out for, it takes like 72 hours before there's a change of temperature inside the box. So we've got a decent window. So sometimes if it's overnight, they'll wait until the morning to send a courier and then it'll get shipped off first thing in the morning.
And the courier has a container that.
It just goes in the box and then it gets sent on an airplane to San Diego.
I was just wondering how much ice you put on it.
It tells you.
Yeah.
There's 2 bags that you have to fill. Yeah, it's very specific. We'll go over it.
You put
Does a sensitive matter?
And if you put too much ice in there, you won't
You
be
can't
able to close the
close.
box.
Yeah.
It's like, you'll know.
And there's a video too. There's a video online that shows us like the processes of packaging it up. And then anything else?